Hey there, welcome to the Alexa Z Show, because life should be fun and meditation should be easy. Today I'm going to shed some light on what is integrative medicine. I am at Turning Point Integrative Healthcare Center in Annapolis, Maryland. They also have one in Columbia. And I'm joined by Dr. Danielle Mcdevitt and nurse practitioner Katie Tolley. We are going to have a really fun, casual conversation on what this stuff is all about. Dr. Mcdevitt is super passionate, not only about medicine, but how she can incorporate her medicine with complementary therapies. It's a whole different ballgame out there, and it's a whole different healthcare regime. She focuses on all kinds of stuff, not just the patient's health, but their satisfaction with life. Who'd have thunk that? It's big. She truly believes if you're going to prevent, cure, and manage a disease or an illness, manage. You got to do that, right? It's critical. She feels it's critical to maintain a balance. Everything from eating to stress management, which of course, meditation's in there, right? And let me tell you, Katie is super cool. She's a certified pediatric nurse practitioner and a child and adolescent mental health specialist. Say that 3 times fast. She's super cool, and she is passionate about working with families. Heck, for over 2 decades, she's given a really unique perspective, not only as a pediatric provider, she's also the mother of a child who's experienced healing from these integrative treatments that we're going to talk about. So hang tight. It's going to be interesting and informative and, of course, fun. And the best part is, at the end, I got them to agree that our next podcast with them, which will be in February, is going to be on ADHD and anxiety in our youth. Big topic. So hold tight, grab a glass of water, adjust your clothing, get comfortable, go for a walk, whatever you got to do, and let's fire this up. A show for those who want to meditate or maybe tried, loved it one day, hated it the next, or maybe forgot why the heck they're supposed to do it anyway. Well, you landed on the right show. Do you still find yourself wishing you had more time, waking up tired, wanting to take back what you just said to your boss? Seriously, don't you just want to spend a peaceful, productive day with time left to learn the guitar and start that $1 million side hustle? Follow me at alexazmeditates.com/podcast and let's make it happen. Hey there, Alexa Z here, and again, I am at Turning Point Integrative Healthcare Center, and I'm super excited to be sitting here with Dr. Danielle Mcdevitt, who I am allowed to call Danielle, and with Katie Tolley, who is a nurse practitioner and super cool. And if you want to know more about them, you can check out their large, amazing bios in the show notes. But let's get down to it. This medicine thing is pretty darn confusing. I see integrative medicine signs, I see functional, I see naturopath. I am completely confused. I'm assuming my audience is too. So, Katie, can you tell me what exactly is integrative medicine?
Sure. So a lot of people aren't real familiar with what integrative medicine is, but when you think about what we're used to in medicine every day and what we're going to, the doctors we've been going to for decades, we call that Western medicine, allopathic medicine, more modern medicine. When we're thinking integrative medicine, we're kind of pulling other therapies into that are referred to more as functional medicine. And in functional medicine, we kind of look at the whole bodily process and what systems are affecting each other. And in integrative medicine, we put the functional part and the allopathic part together and try to make everything work by looking at all options available and stepping in and outside the box.
So, correct. So allopathic is Western.
Yes, ma'am.
Okay, so it's kind of like little Eastern, little Western, kind of mixing everything together, looking at everything, nothing scary. Like, are you going to give me drugs and also some herbs?
Depends on what you got going on. So I'm going to try to give you as little as possible, except for the normal things that are going to support your body, vitamins, elements, nutrients, those kinds of things. Hopefully we can get a lot of that from foods. Sometimes we can't get everything we need from foods and herbs. And there is absolutely a place for more modern and pharmaceutical medicine.
Okay, so what I'm hearing is the integrative part is pulling some of those things that we just don't naturally think our Western doctor is going to prescribe for us. And I'm using the word prescription loosely, suggest for us, whatever. So you're pulling in other things and even other therapies right? I mean, hey, I'm a meditation person. This is the meditation motivation show. So you better be for this or I'm not going to post this podcast. So, okay, I'm sorry I said that. Yoga, whatever, exercise. There are other acupuncture, whatever that is, different things that my listeners would be like, oh, I know what that is. You would pull in. Is that correct?
Absolutely. Actually, the founder of our clinic does practice acupuncture. So all therapies are included.
Who is the founder of this practice?
That would be Dr. Mcdevitt.
Very good. Thank you. I knew that. I just want to get his name in there because he's a very cool person.
He's amazing.
So with all of this, I'm turning my head right now over to Danielle, Dr. Danielle. And out of all these things, what's your piece in this?
So I think for me, I tried to pull in both sides. Katie, you couldn't say it more beautifully. From our patients, both what I guess we would say would be Western and Eastern medicine. But I think where we lose a lot and that we need is that our core basic needs. And that's where I think I play a big part, is kind of bringing people back in and being like, what do we need basic, from nutrition to sleep to exercise? Meditation is probably my number one prescription, but it's the hardest thing for people to do.
No, it's not. It's easy. I will teach them. You're doing the hard part. So what are the different kind of things that you focus on? I mean, I know there's a million things, but what are some of the if there is a couple of buckets that you focus on?
Oh, definitely. So the root things are a lot of times inflammation. The inflammation is caused by a lot of toxicity that we have. Then we focus in on nutrition, gut health, our adrenal health, and our mental health. So they all play a role to actually make someone feel better, heal better, and be whole.
Right. Well, that's the whole thing, I think, no pun intended, the whole thing that I like about practices like this is I feel like you're not just looking at me from a medical perspective, but you're looking at me from a whole life perspective. And one thing that just jumped out was the word inflammation. It's all over the news. My husband swears he is not fat. He is just inflamed. Even my AARP magazine, whole issue on inflammation. And yes, I am over 50. Can you give me a little bit more on inflammation?
Definitely. So, inflammation, it's a broad term, but a lot of times inflammation is what makes us feel horrible. And it comes from what we're eating. It comes from having that extra fat. It's very inflammatory. It's the root cause of disease and illness. So we know if we have tons of inflammation, our cells are not going to function appropriately. Our heart's not going to function well. If our gut's fully inflamed, we're not getting the nutrition we need. So it's a root cause of a lot of problems.
So again, it's a good thing it's me on the other side because I'm probably even less informed than your patients. Inflammation to me means swelling, getting bigger. Is that what we're talking about here? Katie's over here nodding her head. What is inflammation?
Absolutely. Inflammation. So let's think about, there's good inflammation and there's bad inflammation. So inflammation is our immune system responding to something. So let's say that you cut your hand and you need the inflammatory process to come in there and help your body heal. That's part of your immune system's function. It's fabulous. That's what we want inflammation to do. But when our body has different assaults all over, then we become inflamed all over. Systemic inflammation. And that, the root cause of disease that Danielle was referring to, that's chronic inflammation. And that is really the root of where we practice.
So, and that's a very good point. There is normal inflammation, but what we are seeing, I think a lot, is that our body is not turning off the inflammation. It is not just saying, I have an injury, let me send those cytokines, those inflammatory markers, and let me do the job. It doesn't turn it off. And then that's where we're seeing a lot of issues.
Is it kind of like being in fight or flight all the time?
Go
ahead. This is a conversational thing. No, there's no turns here. Go for it.
Yeah, fight or flight. I was actually listening to another podcast because I love podcasts. Mm-hmm. So I was listening to a podcast this morning and they were referring to fight or flight. And it has become if you hear inflammation, you hear a lot about fight or flight. So fight or flight is what your body's supposed to do when it's in a state of stress. And stress can be a good thing. We're supposed to respond to stress. It means our bodies are valuing something that matters to us and we need to do something to address what's going on with that stressor. The problem is when we feel like there's a 24/7 stress assault. And when that happens, our systems, multiple systems, not to get into lots of details, but multiple systems just are out of whack. Your hormones, your neurotransmitters, your memory, your cognition, your focus, your relationship, the way you respond to people, because you can be inflamed to a point where it's hard to even have a decent conversation because your mind is just so disheveled.
Exactly why you need to meditate. Got to keep sliding that in there. And when we talk about fight or flight, it's like, yeah, you definitely need it, but we're in a world where so much is coming at us. And, you know, we don't mean to not be in fight or flight. And fight or flight now gets a really bad rap because we do need it. And even our emotions, right? What is an emotion? It's something, a reaction to a strong stressor. So I have to bring it back to what I know, and then makes me understand a little bit more. So Danielle, you're nodding your head over there. You're looking inflamed. Yeah. You're inflaming yourself. Chill out. No, I'm kidding.
Well, I mean, that's where meditation really is important to us in this practice, is because a lot of times our patients are in fight or flight and they are, how do I get out of this? Like, what do I do? And I'm like, you need to stop. You need to breathe and you need to meditate. Because the really amazing thing about meditation is that it really pulls in your parasympathetic. And our parasympathetic is when we rest and digest. Everyone's constipated. Well, you need to relax so you can have those bowel movements.
Whoa, meditation helps constipation.
Yes, ma'am.
That sounds like another podcast.
Can't detox if you can't get it all out.
That's true. That's true. That's really true. So another thing, I don't even remember which one of you said, we're talking about adrenals. And in my office, I've got a whole office full of massage therapists and skin people, and we're always talking about how stressed out we are, and how our adrenals are shot, and we're totally off kilter. And you know, it must be not just our patients or our clients, but us. Like, oh, I'm so off. I think my adrenals are shot, and then we blame it on the moon, and then the government, and the pizza we ate, and we really have no idea what we're talking about. I mean, we understand a little bit. Can you expand a little bit? What is up with adrenal health? It seems like you focus a lot on it.
Well, I can speak probably as much from personal experience as I can from the experience of a provider. I think Danielle can pinpoint a lot more about hormones and how our hormones are significantly affected by our adrenal health. But that stress response, that fight or flight response we were just talking about, puts our adrenals in overdrive. And when you can only stay in overdrive for so long before you're going to just peter out. So
what does an adrenal do?
Wow. That might be a whole other podcast.
Okay, give me. Yeah,
all right, short version. Your adrenal is going to provide homeostasis, balance for your whole hormone cascade. Mm-hmm. So you're talking energy, you're talking sleep, you're talking communication skills, you're talking mental fatigue, physical fatigue.
Which makes me, and you mentioned hormones, and now I'll say, Danielle, so you're looking at a premenopausal, hoping to crash through menopause without ever looking back. Like, I'm not even going to notice I'm going to go through it. Look, my husband would disagree. So adrenal hormone, am I starting to connect some things?
Oh, definitely. So, you know, the adrenals are these really tiny glands that sit on top of the kidneys, but they do a lot. So they play a role in releasing cortisol and some of our sex hormones. And so if you think about what the adrenals will do, when they wake us up in the morning, they release our cortisol. And then they are supposed to calm down as the sun goes down, and they get the cortisol level really low, and then our melatonin spikes, and we should sleep, and it resets at night. However, what's happening to a lot of people is that we are just pushing these adrenals to no end, and we're just spiking cortisol.
Gotcha. And cortisol, everybody usually is like cortisol. They're like stress hormone, belly fat.
Exactly.
But there's a whole lot more. It's cortisol in our brain too, right?
Correct.
Yeah. Mm-hmm. So if we get rid of that, if you get rid of something bad, doesn't it give room for something good?
Exactly.
Or am I making that up?
No.
I'm not
Sometimes
a doctor.
it's the
I just
other way
play one
around.
here in your facility.
Sometimes we
today.
need to bring in a lot of good so that we can push the bad out.
Gotcha.
I can name a couple of things. You think about, gut health, putting in good nutrition before you even worry about taking out bad nutrition, starting a meditation practice before you even worry about all those stressors. Deal with them. They're not going to go away.
I like that. I think, if I'm correct, you're saying you don't have to wait until the symptom arises. Let's start working on it now, right? I always say for me, my meditation is a vitamin. It used to be a pill. It was for panic attacks. That was the only reason I got into it. But after a while, it's a vitamin, and I never forget to take my vitamins. So if we all went down the path of integrative medicine, started taking our vitamins, we'd happily put you out of business. No, I'm only kidding. So once we're talking a lot about adults, is this just for adults?
Well, that's my role here. I am the pediatric provider here. So, when we think about the adrenal health you were talking about, we think about adults, but that does also happen in children, and it usually happens because of the toxins or chemical overexposure or disease processes or just inflammation that comes from the standard American diet that a lot of us aren't able to tolerate and or detox from because of different bodily system kind of getting a little clogged up.
Gotcha. So it's for everybody. And then that made me think of sensitivities. If every day it's and I'm afraid to even make dinner for anybody because they're they can't eat this, they can't do this, they can't smell this, they can't touch this. What's up with all these sensitivities? Why is this new, or do we just disregard it in the past?
I think it's becoming more prevalent now. And I think the reason I think it's happening is because we live in such a toxic world, and then that we don't know how to detox or support us. So then we are starting to be more sensitive to things, to smells, to food. And, we have patients who are sensitive to noise, to light. And it's because, going back to the foundation, it's not strong enough to handle it. And then you become sensitive. A lot of people, handle it for a long time, and then their body is just overwhelmed. So that's where we try to come in to support them, to be look, we can get through this, but we got to get you strong again.
Gotcha. I am dying. This is killing me because I'm just let's talk about detox. I'm I told the Danielle and Katie, I said, let's not give too much information because there's so much good stuff in here. And here I'm just dying to ask you all these questions. But I think we've had a really good foundation of what integrative medicine can be and can be to the people listening to this podcast. But I can't lie. I'm 52 and I'm starting to feel like I'm doomed. I should have started this when I was young. Am I doomed?
You're not doomed. There's no better time than now. And that's for when we were young, when we were a teen, we're 20, and all the way until we're 100, to really support and make you the best person you can be and the strongest, and live like a superhuman.
Superhuman. Oh my God, I was just going to say superhuman. I was going to say, are you biohackers?
We want to be biohackers. Yeah. If you were asking before the podcast about a passion, that's kind of, maybe that would be us. Yeah. We want to be biohackers. We would love to have the time and profits to invest in figuring out all that fun biohacking stuff, so that, because you said, I'm 52, am I doomed? Not if you listen to the biohackers. Their goal is to live to 120 and 180. Yeah. So you were asking about detox, learning about integrative medicine, learning about meditation, learning to reverse age biohack. Yeah. Sounds like a great idea.
Sounds like a great idea.
That's one more rabbit hole.
I don't want to live to 180 because my money will run out, but I definitely would like to be as alive and kicking until the very end. Well, this has been amazing, and I already have a list in my head of more things I'd like to talk to you about. So hopefully you didn't dislike being here behind these microphones today, and we can do this again. Thank you so much. Anything else you want to add before we go?
No, I look forward to doing this again, and it gives us an opportunity to tell people about us and obviously learn from other people. And then on a funny note, if you guys ever get to meet me, I'm about 5'0". So I am behind this microphone and barely can see anyone, which is very hilarious to me.
And I had to kind of tell her to get behind the mic a little bit more because she wants to look at me and smile, because she might be a very smaller type person, but she has a very big personality and very big presence. So signing off. Thank you so much, ladies. This has been a blast. I look forward to doing it again. And next week, I don't even know what the podcast is next week, but stay with us. Hit subscribe. If you guys hit subscribe, that means I'm going to continue to get people like this on the podcast. If you don't, then I'm going to be really sad. So go for it. Thanks. I'll see you next week. Later, taters.